Hey everyone, welcome back. Dr. Scott from Enhanced Wellness. Today we're going to be continuing our discussion on the connectedness of the body. We're going to be using the example of the lower spine, pelvis, and hip. And we'll use that region primarily because that is by far the most common area of complaint that we have from our patients and our clients relative to mobility, performance, and injury issues. Now, there's three primary ways that we want to think about the connectedness of this area. The first is through the skeleton. So if we take a look at this model over here, we can see that the spinal column ends at this point here and is connected to a triangular shaped bone known as the sacrum. The sacrum connects on the left and the right to another bone known as the ilium, forming the sacroiliac joint. As we follow the ilium bone around into the front, we'll see on the left and the right a socket that forms the hip joint. So the hip, pelvis, and lower spine are connected intimately through the skeletal connections. Secondly, we want to consider the muscular connections in this area. Now, there's a whole network of muscles creating a complex connectedness between the abdominal muscles, the deep flexor muscles of the hip, the hamstring, the gluteal muscles, just to name a few. Now, these muscles basically work together in order to create the movements that are characteristic to this area. The movement area is the third part of the discussion that we need to have relative to the connectedness here. So any movement that we perform throughout our day that involves lifting, squatting, moving from a sitting to a standing position, climbing, and especially athletic movements are important to consider when we talk about the connectedness of the hip, the pelvis, and the lower spine area. So skeletal connections, muscular connections, and movement connections are all a part of how this area is integrated together. Now, as we go forward, what we want to do is share with you some videos that will show us how to begin to deal with some of the most common movement problems out of this area. The next video is going to deal with hip joint and hip joint mobility specifically. Please stay tuned for those videos. Please share your comments and let us know what else you want to hear about relative to health and wellness topics. Until I see you next time, stay well. Thanks for watching.